start the recording. Madam Chair, I'll turn it over to you.
I now call this meeting to order. The time is 8:40 a.m. and the Oregon Board of Physical Therapy is entering public session for the purpose of roll call and other things.
Erin.
Here.
Sandra.
Here.
Oku.
Here.
Becca. Becca, I'm not sure I got you unmuted. I think she lost her connection. I'll move on to Michael.
Here.
Susan.
Here.
Erica.
Here.
Dwight.
Here.
For the record, Becca Reich was connected but is reconnecting. I will move on to staff while she's getting reconnected. Present for staff, Michelle. Sherry. Sherry.
Here.
Kayla.
Here.
Sarah. Sarah.
Here.
Angie.
Here.
And has Becca been able to reconnect? Okay. For the record, I think Becca is having some audio, but is present for the meeting. Okay. We do have several guests today. Thank you for attending. We do have a public comment period for any comments related to today's agenda coming up shortly. What we ask is if you wish to make public comment, that you use the raise hand feature. The chair can recognize you, and then if you can limit testimony to 2 minutes, and then we can proceed to anybody else who wishes to make comment. But thank you for being here. Of course, we start every meeting with emphasis on our statutory purpose as established by the Oregon Legislature to protect the public health, safety, and welfare for all Oregonians by maintaining standards for quality care, professional skill, and competence through the effective regulation of the practice of physical therapy. And with that, first item of business are the board motions as a result of executive session.
Thank you. In case number PT 775-08/22, I make a motion to close case.
I second it.
All those in favor, please say aye.
Aye.
Aye. Any nays, please say nay. Any recusals? Any abstentions? Motion carries.
In case number PT 782-08/22, I make a motion to close case.
I second the motion.
All those in favor, please say aye.
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 Any nays, please say nay. Any abstentions?
This is Erin. I'm going to place an abstention.
Okay. Any recusals? Okay, motion carries.
In case number PT 824-08/23, I make a motion of finding of sufficient evidence of violation of ORS 688.140 little a, little b, little e, OAR 848-045-0020 little I, OAR 848-040-0145 parentheses 3 close parentheses, and OAR 848-040-0145 0170, parentheses, number 1, parentheses.
I second the motion.
All those in favor, please say aye.
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 Aye. Any of those against, please say nay. Any abstentions? Recusals? Motion carries.
In case number PT 832-10/23, I make a motion of finding of sufficient evidence of violation of ORS 688.135, parentheses 1, and parentheses little a, little c, ORS 688.140, parentheses 2, close parentheses, little a, little d, little f, OAR 848-045-0020, parentheses 2, close parentheses, little I, OAR 848-040-0155, parentheses number 1, close parentheses, little a, little b, and 2, and OAR 848-040-0170, parentheses number 1, close parentheses.
I second the motion.
All those in favor, please say aye.
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 Any against, please say nay. Any abstentions? Recusals? Motion carries.
In case number PT 831-10/23, I make a motion of finding of sufficient evidence of violation of ORS 688.135, parentheses 5, ORS 688.140, parentheses 2, little a, little k, big A, and little m, and OAR 848-045-0020, parentheses 2, little I, little j, little l, little n, and 2, little p, a.
I second the motion.
All those in favor, please say aye.
Aye.
Aye. Any against, please say nay. Any abstentions? Recusals? Motion carries.
In case number PT 835-11/23, I make a motion to close the case.
I second the motion.
All those in favor, please say aye.
Hudson
Aye.
Services.
Aye.
Aye.
Any nays, please say nay. Any recusals? Abstentions? Motion carries.
In case number PT 836-12/23, I make a motion to revoke license for violations of ORS 688.135, parentheses 2, close parentheses, and parentheses 5, close parentheses, ORS 688.140, parentheses 2, little a, little k, big A, little m, and little t, and OAR 848-045-0020, parentheses 2, little I, little j, little l, little m, and little p, big A, and OAR 848-040-0105, parentheses 6, close parentheses.
I second the motion.
All those in favor, please say aye.
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 Any against, please say nay. Any abstentions? Any recusals? Motion carries.
In case number PT 843-12/23, I make a motion to deny application for license for violation of ORS 688.120, ORS 688.140, parentheses 2, and parentheses little a, little c, and OAR 848-010-0044, parentheses 2, close parentheses 3, and 7.
I second the motion.
All those in favor, please say aye.
Aye.
Aye. Any against, please say nay. Any abstentions? Any recusals? Motion carries.
In case numbers PT 838-12/23, PT 842-12/23, PT 837-12/23, and PT 826-09/23, I make a motion to ratify the administrative closure of these cases pursuant to delegated authority.
I second the motion.
All those in favor, please say aye.
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 Gonna be next Wednesday, so due to the weather, that service is rescheduled.
Any against, please say nay. Any recusals? Abstentions? Motion carries.
Madam Chair, there's no more motions as a result of the executive session.
Thank you, Hoku.
Next item of business is the consent agenda, which includes the minutes from the November meeting, the ratification report of licenses issued since the last period, and the director's report. The board members received the materials ahead of time to be able to review the minutes, which will then subsequently be posted on the website once approved. The list of licenses issued, and then the director's report for the period. Madam Chair, if there are any questions or corrections on the minutes from the members, we could discuss those now. Otherwise, we would need a motion to approve the consent agenda.
I'm prepared to make a motion to approve the consent agenda with your permission, Madam Chair.
Yes.
I second. Oh, somebody go for it.
I move to approve the consent agenda items as written.
I second the motion.
All those in favor, please say aye. Aye. Any against, please say nay. Any abstentions or recusals? Motion carries.
Madam Chair, the next item is the public comment for any comments from members of the public attending today pertaining to today's agenda topics. If you're interested in making comment at this time, please use the raised hand function. And I'll just pause a moment. Okay, Madam Chair, no raised hands at this time.
Okay, let's continue.
Next order of business is the delegate reports for the Physical Therapy Compact Commission and the Federation of State Boards of Physical Therapy. Sherry, I can turn it over to you for the update from the Compact Commission.
Yeah, thanks, Michelle. Just wanted to give a report that the PT Compact Commission had their annual meeting on December 5th. I attended that meeting, and there are, just as far as it's going to just give an update of states and entering the compact. Looks like the next state who's going to enter the compact is Alabama, and that should happen by July of 2024. And there are 7 states that are on the list to most likely introduce legislation in 24. That would be Alaska, Hawaii, Minnesota, Illinois, Michigan, Rhode Island, and Massachusetts. So quite a lot. After that, that leaves only California, Nevada, Idaho, New Mexico, New York, Florida, Puerto Rico, and the Virgin Islands that have not interested. So kind of exciting that we're going to have a big push, it looks like, this year for members to compact states. If anyone has any other questions.
And I think the only other note is that our own Sarah Casey was appointed to one of the subcommittees, the Education and Outreach Committee. I believe that's a 1-year appointment, 2-year appointment.
And I am going to be the vice chair of the Compact Compliance Commission for the next year.
And Sherry, that's the committee you've been serving on for the last year or two?
I think this is my 3rd year on that committee. So, or actually 2nd or 3rd. COVID kind of blurred it for me, but it's the 2nd or the 3rd year that I've been on this committee.
Absolutely. Any questions of Sherry about the compact? Next, from the Federation of State Boards of Physical Therapy, there are just a couple of highlights that are on the screen. Erica, is there anything else that you wanted to highlight?
Nope, I just wanted to encourage new members, especially about the regulatory workshop in May. It's a really good experience. So I'm hoping, if possible, that people are able to go.
And one note, if you're looking far enough ahead in our meeting schedule, you'll note that the regulatory workshop, apologize for the typo, overlaps the scheduled in-person board meeting. That doesn't necessarily need to discourage you from attending because it is a worthwhile event. So what I would request is that if you're interested in attending the training, that you connect with me so we can determine if we will have a forum for our meeting or if enough folks are wanting to attend either the virtual or in-person session. We may need to then adjust our board meeting to accommodate that opportunity. I think the other note is that you'll see that the selection of the delegate and alternate delegate is earlier than we typically do it. They are seeking that certification by the 1st of April, where in the past we've been able to do that at our May meeting. So this is a heads up to think about who would like to serve in either of those roles. We'll send out the specific dates for the commitments of the meetings that would need to be attended in those roles. And then we will need to do the selection at the March meeting. Any other comments or questions about Federation delegate report? Okay. Next order of business is an update Oh, yes, my apologies. Strategic plan progress review. This is the point where we will look at the current plan and discuss recent activity. Probably the biggest update under this section is that we will be beginning the process of the next major forecast. The years are a little funny here because of the state's biennium cycle. It makes the most sense to end not in 2030, but in 2031. So beginning with preliminary discussions at the March meeting, that would be to identify work schedules or any additional sessions for community involvement in the planning process. We will discuss that at March with the purpose of creating the updated plan. I've mentioned at prior meetings that under Governor Kotek, she has established a standard process and format for state agency strategic plans. So the other thing that we will be doing is transitioning the strategic planning materials that we have been using into the statewide formats while still trying to utilize the every meeting dashboards that we've historically been using. Any kind of questions on that process? What I'll do is just put up the one roadmap. The primary focus since the last meeting has been preparation for renewals, frankly, which every 2 years takes a significant amount of staff involvement and time to process. Okay, seeing no questions, I can move to the next item. Okay. We have an update from the Rule Advisory Committee that was formed to review and provide input to you, to the board, on OAR, Oregon Administrative Rule 848, Division 40. The committee had met a couple of months ago, had a kickoff meeting to discuss the scope of work. At that point, the committee reviewed the advisory committee and made recommendations for adding members from other geographic regions of the states and other practice settings to get as broad an input base as possible. And then last night, we held the committee listening session where Sherry and I met with the committee and scrolled through the entirety of Division 40 to hear input line by line from the committee members on comments or questions or areas that they felt could be better stated, made more concrete, or areas that perhaps have shifted in the way practice works since the rule was initially created. Some of the rules date back to the early 2000s, and there have been different sections. So Sherry, I don't know if you want to say anything else about how the process went last night.
Yeah, I thought it was great. I mean, it was definitely a long meeting, over 2 hours, and we had, I think, 12 to 15 people there, and it was really vibrant discussion. Everybody had a lot of input. I really was impressed by the committee. They definitely had done their homework and looked through the rules very thoroughly and had a lot of, I think, really good input for the board to think about. And the thing that I really liked is we had people from all over the state, from every practice area. I think we pretty much had everybody, everything, and everybody covered. So I really appreciated that, because you'd have somebody saying, well, in my practice, this needs to happen. And then people say, well, in my practice, that can't happen because, you have someone in acute care, someone in outpatient private clinic, you had people representing the school system, people representing home health. So, it's just our practice is so broad. So it was really good to hear, what does and doesn't work depending on the practice setting and the staffing too.
Next steps will be to take all of the input that's been received from the committee in writing and then the verbal discussion yesterday and aggregate that into a single document, noting the comments or the questions in the context of the rules themselves, and also noting where there were differences, as Sherry was describing, in impact in different settings, or if the committee members individually may have made different recommendations on how a change might look. We've been really focused at this point at just identifying questions or problems or areas to focus, and have not yet shifted into recommendations of what that would look like. Once we take the aggregate information, that will be sent back out to the committee members, and another meeting will be scheduled most likely in the April to May timeframe after the renewal season, to go through all of that information and begin the process of teasing out specific recommendations, and creating an instrument that can be shared broadly to get more input from all stakeholders, to then bring that back to you, the board, for consideration of any formal public rulemaking that you may wish to engage in based on the recommendations from the committee and the broader public input. That, of course, starts the formal process of public input on any specific formal rules. So it'll go back out to make sure we're casting as broad a net as possible for input before it would come back to you that one last time to potentially adopt the rule amendments. Any kind of questions from the board on the work of the committee to date? I think the other thing I would like to put on record is just, and we said this to them directly last night, just the appreciation to the committee members for volunteering their time for this work effort, particularly this week. As all of you know, it's been a challenging week in all parts of the state. And we did have some folks that went to extra effort to be able to get into a location to be able to participate in the meeting. So on record, my thanks to their work and their commitment to this process. Next order of business, general roundtable from any comments or topics from board members. I did put one starting topic here to give an update on CLEAR, which is another organization, but I'm going to turn it over to Sherry to give some updates on CLEAR events.
Yeah, thanks, Michelle. So last week, Michelle and I were able to attend the CLEAR mid-year business meeting and symposium. I am participating on two committees for CLEAR. One is a committee where we're looking at the trainings that they offer throughout the year. Mainly the ones that I'm looking at are the investigator training. So they offer a basic and a specialized, and I'm on a committee where we're going to sort of revamp both of those programs and get them just as up to date as we can. And then I'm also on the planning committee for the annual meeting, which is in September in Baltimore. But before the business meeting, there was a symposium on artificial intelligence. Michelle was one of the speakers. It was amazing. You know, I think I went into that as like, I don't know what I know about artificial intelligence or what I care to know. And I learned so much in that one day. It was a whole day. They brought in all these different speakers. Michelle was on the panel. It was really great. And it made me think about so many different things about how AI is going to affect the board in many different ways, you know, as we move forward. I also wanted to say, I don't know when the last time we had someone attend, but CLEAR also does put on board member trainings. They have different levels of board member training classes. So it might be something, you know, if someone wants to have some kind of board member training, but doesn't want to miss the board meeting, to go to the one for the Federation. I think right now, all of the ones CLEAR is offering are virtual. So maybe I could look at sending that out to the board members, but I'm still here in Tucson because I came to that meeting, but it was really, really very worthwhile, and I'm glad I attended.
One of the board, of course, is a member of CLEAR, and one of the values of CLEAR membership is where the Federation is the all organ or all physical therapy regulatory body. CLEAR is comprised of regulatory entities from all disciplines and not just healthcare either. It is also an international organization, so you get perspectives and input from predominantly Canada or the United Kingdom and Australia, but from different perspectives and different regulatory models. As part of our membership, you have access to their reference library as well. So I think more here. There are also, there was a call for proposals for the annual meeting in September. I believe those should be announced in the next month or so. Sherry is part of one proposal for content at the meeting. I am also part of a panel proposal as well, but we should hear in the next month or so whether either of us are being selected to present at that event.
Michelle, would this be a good place for me to mention the Federation of Medical Boards meeting?
Indeed.
So at the annual meeting for the Federation of Medical Boards, which is like our FSBBT, but for medical boards, I am going to give a presentation in April on trauma. And I'm really excited about it. It's a presentation on trauma of the licensee, and licensee bringing their own, what they bring to the table when they may offend or do something that is unfavorable, and then for the boards to kind of look at it from a different lens of how that affects the board and the licensees. I have spoken with, I'm presenting with two other presenters, a physician and a chiropractor, and I've spoken with them and Michelle a little bit, and we may do a little preview at the March meeting before I present at the April meeting for the Federation. I say the March meeting, our March meeting, our board meeting. So you guys can get a little preview of the presentation before I give it at that big conference.
Thank you, Sherry. Any other updates? Thank you. Madam Chair, okay to proceed? Okay.
Yes, thank you.
The first general discussion item for today is on the 2024 legislative short session, as they call it. Short session is in quotes because it's short from a calendar standpoint, but it's really more compressed as far as it feels like the number of bills. Everything happens in a much shorter period of time, generally in the month of February. Because of the timing of our meetings, we're at the cusp of session. We don't have all of the bills released yet. We're aware of some legislative concepts that may be dropped into this process as bills, and I'll talk about that a little bit. But our next meeting isn't scheduled till March, which means it is possible that the board may need to convene a special session if there is proposed legislation that would have an impact to the board, where we may need to deliberate and be able to give testimony if requested to the legislative process. In a short session, agencies, individual agencies do not have bills or legislative concepts. The governor in the executive branch is limited to 5 bills. And so those are going to be targeted at the high-level governor priorities that she has established. Otherwise, it's the bills or the legislative concepts come from the legislature itself on behalf of the broader Oregon community. So far in the process, what I am aware of are the legislative concept numbers here. In most cases, the draft concepts themselves have not been distributed, but a legislator or a committee may have given some brief information, which is where I've sourced this information. The first one that would have an impact is legislative concept 98. It is for health professional in general, licensed health professionals in Oregon. And what it does is it creates a new temporary permit that if they are licensed in good standing in another jurisdiction, that they have a means of working under a temporary permit while they're waiting to complete the regular application and licensure process. Part of where this is coming from is that some health professions do require a certain amount of training or continuing competence work or apprenticeship that has to be completed before licensure can be granted. And so the intent is this, if they have been actively practicing and meeting certain criteria, that they could begin to work in Oregon while they are completing those requirements under this temporary permit. For this board in particular, between the compact, which is already in place with quite a number of states, and then our process, which is very expedient already, it won't necessarily add value, or it won't solve a problem or bottlenecks with regard to licensure for the vast majority of applicants. But it will add another step in the process that we will be required to determine the information system processes for creating the new type of license, and then determining expiration dates, because the proposed temporary permit would be good for up to 1 year from the date of application. So that's definitely one that we will need to monitor. Any kind of further questions on that concept before I move to the next one?
Hi, Michelle, this is Michael. I have one. So state to state requirements for licensure vary. And so if someone is licensed in another state that has maybe lower requirements than Oregon for licensure, and wouldn't be a candidate for a compact privilege or a license, they would be under this temporary licensure for a year.
Potentially, but again, this is a concept that may look very different in the final bill. Right now, one of the key pieces that appears to be missing is a background check, which is one of the pieces that we do before issuing a license. There is no provision in the current version of the legislative concept to have that be one of the pieces that is required to be met before the temp permit is issued. And the way it's currently written would allow them up to practice for up to a year before completing that. I would imagine that that gets addressed in amendments through the process as it moves forward, however.
Thank you.
Absolutely. Other questions on this one? The next one, legislative concept 146, and my abbreviations here, overdose reporting to primary care provider. It is intended to be part of addressing the opioid crisis. And if an individual in overdose were to be admitted to the ER, it requires the ER to send notification of that event to that individual's primary care provider. The one notation that is relevant to health professional boards is that information cannot be used by a licensing board. Where that may be relevant is if the individual being admitted to the ER were a licensee, or if it were related in any way to the license, that still would be exempt from being part of any investigation. related to that. So just a small piece that called out use of that information by licensing boards. Any questions on that one? Next one, legislative concept 219, specifically section 40. And I have to call out the section on this one because it is Senator Dembro's omnibus bill, predominantly focused at education and a number of bills over the last couple of years that he's been working on. But section 40 in the concept brings forward a streamlined piece that has appeared, I believe, in the last 2 sessions related to a licensee being able to get, in essence, a pre-qualification letter from the board prior to applying for licensure, where they would submit an application and request that the board review any criminal history and get a determination of whether they would be qualified for licensure or not before they go through the process of formal application. And I believe part of Senator Dembro's intent here is that before an individual may go through the process of investing in the education to go into a licensed field, and to have them know ahead of time if they have any criminal history, to not make that investment of time and money if they would be barred from licensure at the back end. So small piece in that omnibus bill. Any questions on that? Then the last one that I'm aware of at this time is concept 256. It's a bill that relates to the use of the FBI's what they call a wrap back system. And it's a process where different agencies can participate and gain access to any updates or changes in criminal history for individuals. One of the pieces that it sometimes includes in the bill is the ability to potentially, through the wrap back system, share more broadly to other agencies. Right now, the FBI requires that if you were to apply to this board, the criminal history is only reported to and can only be used by this board. If that individual were to apply for another board, it's another point-to-point process. The wrap back concept is looking for greater efficiencies where a person can have their information in a central place, and it allows for quicker access and distribution when they're potentially applying multiple places. It's particularly helpful for individuals that are travelers or do contract work, because it also tends to be used for employment background screenings, and for individuals that may work at multiple facilities or travel, it can greatly simplify the process for them. So that's the last one. Again, these are legislative concepts. They may or may not move forward in this session in this form. When they do drop as bills for the session, they are assigned a different number. And we will be monitoring for other effects for any bills that drop that may have an impact for the board, the work of the board, or individuals licensed by the board. And I guess the final note, if we don't end up having to schedule something in February during session, of course, March, all the dust will be settled, and we'll have a report out on what came out of the short session that needs to be addressed by the board. Okay. Okay to proceed? Okay. The next discussion item is the 2024 renewals. Just an update for you there. As you'll recall, we were initially hoping to implement a major upgrade to the board's licensing system. That project we set aside until after renewals. We weren't confident that the vendor had sufficient time to make the changes and did not in any way want to negatively impact the renewal process as that. So our major, from the strategic plan documents, that has deferred until second to third quarter 2024. So we shifted gears at the end of December to work with the system with some minor modifications that we needed to support renewals. We have been in a period of soft launch to allow us a period of testing before we had large volumes of renewals. So we've made no announcement that the renewal functionality has been live, but somewhat surprisingly, we had individuals that applied the very first day, submitted their renewal applications, which has been great. We've been able to make some adjustments and are working through that process. I think at this point have done sufficient testing. We have at this point, we've had probably, I'd say on an order of 400 renewals come in, give or take. I did not look at it this morning. Unsurprisingly, we do tend to get renewals that come in later in the evening rather than during the day. Oh, Sarah, I think you're on mute.
Can you hear me now?
Yes.
319 renewals have been submitted, and about 200 something have been processed so far.
Thank you, Sarah. One of the changes that we implemented last year or last renewal season, you'll recall, one of the things that we did was fully review the continuing competence for completion of the mandatory units, in part because both for the pain module from the Oregon Pain Commission and the cultural competence requirement, both of those were new at the time of our last renewal. And we wanted to make sure that folks had an opportunity to take the correct courses before we had to process the renewal. We did our best to track that. I think we were estimating that that was somewhere to 28 to 32%. We were guesstimating of folks who had some issue where they may have taken the wrong course and had to have that corrected before they could proceed with renewal. Part of what we've implemented is a way to track that more specifically, so we don't have to estimate it from other data tables. We'll be able to track exactly how many folks are having difficulty with taking the correct types of requirements for the mandatories or other types of issues. We'll go live next week. We will send out an announcement, and we have been discussing multiple notification channels since I think 2015. We have shifted to electronic notification of upcoming renewal period, both through direct email in the newsletters on the website. One of the pieces that we're considering and for discussion is increasingly, I think people are experiencing information overload, emails not getting through or spamming out. And so we have considered going back in time a little bit and also sending out a paper postcard notification of the open renewal and renewal deadline. In costing it out, it's probably under $2,000 to send out a mailing postcard with the information. But that was one of the questions that we had is, do we want to expand the notification channel to paper? And then I think the second piece of that is when we do that, we do have the ability to scale down the list to only people that have not yet renewed. So we could either send out an announcement in the next week or so to everyone as a baseline, or it's something where we could wait until the 1st of March, for example, and send out a smaller mailing to anyone who hadn't yet renewed, but that would still give them approximately 31 days to complete their renewal. So I'll open it up to the board for any discussion. If you would like us to move forward with that concept and kind of your thoughts on how best to approach that.
Hi, this is Hoku. I think it's really, oh, I'm sorry, Becca. I just jumped ahead of you. I think it's really inclusive. It's an inclusive step for folks who are not accessing their email often. So there's that part of it. The other part is that in terms of like environmentalism and like the things that would be like more prudent to conserve resources, whether it's like financial resources or, I like the idea of not sending out to everyone, but waiting until March to send it to people who have not yet renewed. Thanks for thinking of it.
And thank you, Hoku. One thing I will note is that it is one thing that does complicate it is that until they renew and update their information, licensees are supposed to keep their information up to date or within 30 days of a move. I know that folks don't always have the ability to update their home or their mailing address. So from the environmental standpoint, even mailing some things out, if folks have not kept their contact information up to date, they will not receive that notice either. Becca.
I agree with what Hoku was saying and just thought of one other point, which is that having additional modes of contact may potentially decrease workload on board and board staff dealing with people who forgot to renew. It seems like we've seen a lot of those cases recently where it's a relatively minor thing, but it breaks the law, and so we have to deal with it. So if we could cut back on that, that would be a good thing.
Thank you. Michael.
Yeah, I agree with both of the earlier points. I would just say don't wait too long, just thinking about what Becca just said. So like maybe mid-February, if we think like it's actually a value add to just send to people who haven't renewed. And if we're not sure, then maybe it's just everybody.
Okay. Susan?
Just again, to add on to that, the idea of waiting, if I had already renewed and I got a notification, I might be a little worried that something went wrong. So I think, to conserve those resources of I would look at only those that haven't renewed. And there might be a lag in there by the time I've sent that in until it's processed, but that could cause, if you go ahead and send it out to everybody at a later date, that could cause some confusion about whether or not my renewal had taken place.
Thank you. What I'm hearing is that the board would like for us to move forward with the paper-based outreach as well, in addition to the email and web-based notifications, and that we will target folks that haven't renewed yet. By the time we at least process the list, there'll probably be some overlap. Folks, in the week that it takes to go out, folks might submit. So I think we'll be sure to include messaging that if you haven't, yet renewed, and that will maybe aim between the mid-February, not quite wait until the 1st of March, but try to get it maybe in that mid-February peak. that will let us go for about a month and at least not be targeted at the folks that are already aware of it and are going to process the renewal anyway, but it potentially folks that aren't yet aware. Okay. The last piece is we had discussed this at one of the prior meetings. In 2022, we combined multiple functions in one relative to prior renewals. The CC audit or the continuing competence audit that I just mentioned, we're continuing to do this year. The other piece that we did at the same time was the LEDS or the Law Enforcement Database background audit. The board had moved to the 100% audit of renewal applications. In 2022, we did that as part of the one process of renewing a renewal application. It does add several minutes to staff time for reviewing and processing an application, which I know is a small unit of time, but when you multiply that across all of the number of licensees, it added time to our ability to do processing. What we are proposing is that we revert back to disconnecting that screening and do that as a separate process, that LEDS verification as part of the post-renewal based on the licenses that renewed. It will so we'll do the general review and the continuing competence review before the license renewal approval. And then starting in April and May, we will run the 100% LEDS audit against folks who did renew. Any concerns or questions about that recommendation? The benefit, of course, is that we can process renewals more quickly and get people's licenses squared away and then do that separate process. Okay. The next item relates to the Oregon Health Authority Workforce Data Survey. For those of you that are licensees or hold any of the health professional licenses, this is a survey that is required at renewal of the license. It's not a requirement of the boards, it's a requirement that the legislature established for all health professionals to complete the Oregon Health Authority's workforce data survey before a renewal license can be issued. So the way it's generally processed is an individual goes to renew their license with this board, and then we, as part of that renewal process, send them over to the survey that the OHA controls. They complete that survey, and then they're routed back to our process to submit the application for renewal. The Oregon Health Authority, just in the month of December, came to the boards with a proposal to add, at the time, mandatory burnout or mental health survey questions as part of the mandatory renewal application. The motivation is that because there has been, of course, concern about burnout and the impacts of that, particularly in the healthcare sector, they wanted to quantify that in some way and take sort of a pulse in the state of Oregon of where that's being felt. In meeting with the various health boards, some of the concerns that many of the boards had was that the survey questions were asking individuals to provide personal information that isn't appropriate as part of an application. But it was being made mandatory as part of an application. And felt that mandatory nature of it wasn't appropriate, or part of the scope that the legislature had given the Oregon Health Authority for that mandatory renewal survey. The secondary concern was that some of the questions are relative to on a scale, if an individual identifies that they're in mental health crisis, they could answer that on the survey, but they were not intending to have any follow-up for any individuals that reported out to be in crisis or to be experiencing any kind of hostile environment or abuse in the workplace or anything else. So the questions were there, but with no support or follow-up mechanism, which was also a concern. Chair Shanahan and I discussed it because the health regulatory boards as a group were concerned about this, and we agreed that as a mandatory part, we didn't feel it was appropriate, but that there may be value in some form of a survey on a voluntary basis. Subsequently, the Oregon Health Authority did step back and decide not to move forward with requesting mandatory for it to be part of the renewal. They are still interested in working with the boards to determine if any form of survey on burnout and mental health for healthcare practitioners in a voluntary instrument would be appropriate. And they will begin having further conversations with the boards. So it's something that I could see if they're ready by our March meeting, they could come to the board and have a discussion of what they're thinking at that level and how they would provide support for anybody who would answer that they're in crisis. Any questions kind of on that piece or concerns, or Michael?
Hi, I'm just thinking about this and reflecting back to the presentations at the education meeting from Ohio and Idaho, where both have versions of safe haven programs. And I'm wondering if it might be good to reach out, and I could do this, but to the presenters to see how have they thought about this, and is it or is it not connected to the services that they provide for people who are struggling?
Okay. Anything else on that point? The next piece, SOGI or SOGI, which is sexual orientation and gender identity demographics. This is something the Oregon legislature has put in place for patients that are requested to complete information on these demographics. The OHA is intending to add that to the workforce survey starting in 2025. So for this board, that would become effective in the 2026 renewal. Probably later in the year, they will bring forward what precisely what that would look like, or what the draft questions would look like. So that's another area and another topic where they're seeking to work with this board and get input on their plans on adding those question sets. The final piece is just a call out there has been turnover in the group where the workforce data survey is housed. The Sarah and I have had a series of meetings with their staff. And I am very happy that everyone we've spoken with over there is interested in partnership to improve the timing of the data collection and analysis. Sarah was able to articulate on a technical level some of the issues that we face because of the timing of when they take the snapshot of data across the state is in January. And so what happens is that leaves out the majority of the renewals until a year, or in some cases, more than 2 years later, depending on when somebody has applied or renewed. They've indicated that they're willing to work with us to potentially change when they capture our data to be after renewal, so that the reports that you start seeing across the state, our data isn't a year to 2.5 years older than all the other practitioners, which I think is better for the stated purpose to inform the legislature so that they can, make policy decisions. Any other questions on the data survey or those discussions? Seeing none. That Madam Chair, was the last discussion item that we had on the agenda for today. Unless there's any other business, I can, Susan.
I'm not sure if this is the time to bring it up. I know I had some questions about this, and if it's something that the board wants to look at, about something that's happening in the state regarding physical therapy aids. And I had emailed some information, I think, to Sherry for it came in a form of an ad from the community college in Southern Oregon about a $3,000 program for being a certified physical therapy aide. And there's a certification exam that goes along with that from the National Career Certification Board. And just wondering, in terms of, public protection, in terms of someone charging someone, nearly $3,500 for something that is not required under the name of physical therapy. And then just in terms of how this is being put into practice in the state, if there's this assumption that a certified aide is different than an aide, and if they are being delegated additional tasks. And just, again, if that's something as a board that we want to look at.
Thank you, Susan. I think that what we can do is look at that further and then bring it back in March as an agenda item, so we can get that topic noticed properly, but bring additional information for background and have a board discussion on March's agenda. If Madam Chair, if that's acceptable.
Yes, that sounds good. Thank you, Susan, for bringing that up.
Michelle, I do have the information that Susan sent me earlier this week.
Right. Okay.
And
Then
I'm
we will-
happy to be a part of any further investigation with that.
Okay. Then we will get background on that topic and get it noticed on the agenda for the March meeting. Any other business? Michael?
Or just maybe I ask for the board members. I got an appointment. I don't know. I volunteered for the workforce committee for FSBPT, and aside from the questions we just talked about, I don't know, if you have any input or concerns about workforce related things, please let me know and I'll try to loop back. I think the first time I'll join that committee, I think, is next week. So
Thank you for noting that, Michael. And just a heads up, we'll add you to the committee updates for the March meeting. Other topics, other business. Then Madam Chair, I will turn it over to you.
Okay, the time is 9:50 a.m. and this meeting of the Oregon Board of Physical Therapy is adjourned.
Thank you, everyone.
Thank you.
Thank you. Goodbye.